everyone, it's Dr. Amanda from StraightSmile Solutions, and today we're going to be talking a little bit more about nighttime clear aligners. And I've been getting a lot of questions about it. There's a few companies, which are all DTC companies out there, that are offering these nighttime clear aligners, but people are getting confused. Like, patients are wondering what's going on with these, and does this really work? And doctors are asking because their patients are asking. So I just wanted to clarify, this is my opinion. Now, first of all, there's been, as far as I know, as of today, no published studies about the efficacy of nighttime clear aligners. Okay, so I'm basing what I know. I don't want to get in trouble. I don't want to get sued by any of these DTC companies. So I'm basing what I know based on my personal experience with intermittent forces, which means wearing something, having a little force, then stopping, then having a force again, which is basically how the nighttime aligners work, right? You're only wearing them for like 10 hours a night. And then do the math. There's 14 more hours where you're wearing nothing. So it's an intermittent force. Now, what I know from studying, I have my master's in dental science, specifically in osteoblast, osteoclast. That was my research project. So I know those little cells pretty well. So I know that there's an inflammatory response that happens when you try to move teeth. And I know that it's not healthy for the patient to have intermittent forces. All orthodontists know that. So I'm not comfortable with this whole nighttime clear aligner thing. It's not something I would recommend. There's going to be a lot more discomfort for sure, because of course I've had patients that have tried to do this and they've told me about it, right? So, but the science explains that as well. And also you could potentially, there are some risks that happen with moving teeth. Of course, we barely ever see those risks like root resorption, blunting of roots, issues with the PDL widening, some mobility. We rarely see those in easy, gradual aligner cases because the forces are so slow and low, especially if you're doing 1 week, 5-day changes and keeping that force extraordinarily low and consistent. There are some aligner companies that do 2-week changes or 3-week changes. That is not as healthy. We know that it's a more of an intermittent force. We don't want that, right? And we know that braces have more severe reactions because there's a force every 6 to 8 weeks, and it's a very high force. You hear about that discomfort patients have. I've had braces 3 times, and aligners. I know braces were way more painful than aligners. And I'm not talking about like the pain that comes from rubbing inside your mouth. That's one type of discomfort. I'm talking about the achiness that comes when you get it, quote, tightened. It's terrible for the first 2 days after you get it tightened. You can manage it, but it's pretty bad. But with aligners, with very low weekly changes, 5-day changes, keeping those movements less than, if ideally, I want to see 0.2 millimeters per aligner, 0.25 millimeters per aligner, really minor. But there are some companies out there that are doing 0.3, 0.35 millimeters per aligner, and changing it less frequently. So again, just explaining the whole nighttime aligner situation out there. You can do what you want, but it isn't something that I would personally recommend. All right, thanks so much.